Hello, my friend. I am Dr. Mohammad Shajudri, MSc 007 version. Welcome to science class. As a student of science, I wanted to take flavor every branch of science. What is medical science? Medical science is the branch of what is science? Science is anything, any matter, any event, any problem any occurrence can solve by logic, document, database, mathematical calculation, improvement with experiment. That is science. What is medical science? Medical science is the branch of science discussed, elaborated about human. Human normal physiological system, disease process, disease system, management of the disease. So medical science discussed, elaborated about human, Homo sapiens, and human normal physiological system, pathological system, disease process, management of the disease. That is medical science. So those are my patient. I am Dr. Momo Shuchuri, MSc 007 version. You know that the how patient die, cardiorespiratory failure, every disease system and every traumatic injury or other thing. In case of medicine, surgery, gynaecology, everything, every branch of medical science, you know that how taken. At the end of the stage, die. How die? Cardiorespiratory failure. So, cardiorespiratory failure. What is the? Those are my patient for that. What is the criteria of shock? Without shock, a patient can die. That can be tough. So first, what is the shock? Sure. In what is the symptom of shock? The symptom of shock, first you know that in symptom of shock, tachycardia or bradycardia, tachypnea, raise respiratory rate, raise heart rate, pulse rate, and or reduce pulse rate. At the end of the shock, the first tachycardia. At the end of the shock, the heart when or not pump the fuel, then at the end of the shock, the reduce the pulse rate that go to the below 40, and tachypnea and tachypnea raise the respiratory rate, breathing rate. At the end of the shock, the when fuel is lung fuel is oxygen is not, then lungs also collapse or lungs also reduce their work. The tachypnea raise the respiratory rate below the 8, below the 10 or below the 8. And in case of heart rate, end of the shock, the heart rate go to the below the 40, below the 20, and respiratory rate closer to the below the 8. That is the end stage of shock. In case of early stage of shock, tachycardia, tachypnea. Then cold clammy skin, but that is not necessary. Cold clammy skin in the shock, in that of shock, you know that. So those are my patient is develop shock. What is the type of shock? How the what is the shock? Shock is the condition. In that shock is the condition of patient. In that condition, respiratory rate, raise the respiratory rate, raise the heart rate, and cold clammy skin, and heart rate, respiratory rate, and cold clammy skin, and in case of in case of patient and patient pulse rate, also you know that pulse এবং respiratory rate, then you go to the you in the when that condition develop, in case of also in that position there is a other symptom. In case of neurogenic shock, develop severe pain. With that symptom called the how you condition, in case of neurogenic shock develop severe pain. In case of cardiogenic shock, also chest pain. In case of neurogenic pain, headache, severe headache. Okay. In so in case of tachypnea, tachycardia, also in case of neurogenic, severe headache. In case of cardiogenic shock, severe chest pain. In case of bacteria sepsis, bacterial shock or sepsis, develop shock, sepsis. In case of bacteria, when go to the blood, develop sepsis. In that sepsis there is a fever. Okay, fine. Bacteria, viral fever, symptom also bacterial shock, and bacterial sepsis, viral sepsis, then go to the shock. In case of infectious sepsis, infectious disease or infection, if a shock arises from the injection, there is a sign symptom. Symptom is fever, shivering. Understand? Bacteria, viral, and protozoa helping. There is a, in case of arise shock, before arise shock, you know that there is a shivering, raise of temperature. Okay, fine. Now we discuss about neurogenic, cardiogenic shock. তারপরে নিউরোজেনিক শক, কার্ডিওজেনিক শক, septic shock. We discuss about septic. In case of septic shock, bacteria, virus, protozoa help me. Okay, fine. Septic shock. So now we go to the then neurogenic shock, cardiogenic shock, septic shock. Then we go to the anaphylactic shock. In case of anaphylactic, allergen particle. Tachypnea, tachycardia with allergy particle. There is itching, severe itching. You know that allergen particle. So that is the septic shock symptom sign. Then we go to the hypovolemic shock. In case of hypovolemic shock, tachypnea, tachycardia, also the volume reduce. Also the shock show the thrust. Patient feel thrust, hypovolemic shock. Also patient hypovolume. In case of hypovolume patient, you know, tachypnea, tachycardia also present. Thirst, also the less urination. Urination is not occur properly. So what is the management of the shock? If you understand the shock, every patient can die. Maximum patient can die, that develop shock. Medicine, surgery, kind of shock. So those are my patient. If develop shock, tachypnea, tachycardia, you can pass oximeter utilize in your phone. Have the pulse rate and respiratory rate. And what is the oxygen saturation? In case of shock, pulse rate, tachycardia, respiratory rate, tachypnea, raised respiratory rate. The normal adult respiratory rate, you know that 16 breath per minute. It go to the 20, above 24, 24, and pulse go to the above 100, tachycardia. And oxygen saturation also reduce. Oxygen saturation below the 80. Pulse oximeter oxygen saturation below the 80. You know that there is a chance of develop the shock. For my patient, go to the hospital. So, and what is the management of shock? In case of neurogenic shock, pethidine, morphine. If you not give pethidine, morphine in IV route, if you give methadone, morphine in IV route, there is a chance of, if any neurogenic spinal cord injury or other injury, you know that there is a problem. So give pethidine, morphine, IM route. In case of some cases, the shock is developed with misinterpretation. The shock is not neurogenic shock, septic shock. If you give to the pethidine IV route, what happens? Patient can die. So in case of neurogenic shock, give pethidine, morphine, IM route, not IV. That is the experience. Then cardiogenic shock. In case of cardiogenic shock, dopamine, adrenaline, in drip. Also, if heart rate go to the below 20, then you can give that the give the bed IV route or IV route, okay, pathidine, morphine, adrenaline. Before, if heart rate is above 40, then you can treat by atropine and dopamine. And if heart rate go to the 20, below the 20, then can treat with adrenaline. Okay, fine. So we discuss management of neurogenic shock, cardiogenic, septic shock. In case of bacterial culture media, blood culture media, you found the septic shock. Tachypnea, tachycardia, also fever, days of temperature. You know that the shock developed from the either bacteria, viral, protozoa, helping. And treat the cause. If bacteria, antibiotic, IV route. If viral, antiviral. If protozoa, antiprotozoa. If helping, anti-helping. Okay, fine. Now we go to the septic shock. In case of septic shock management, we already said. Then go to the anaphylactic shock. In case of anaphylactic shock, allergen particle, so you give the antihistamine. IV route, you give the antihistamine is the choice of blood. But the septic anaphylactic shock develop about in the blood match cross blood reaction occur, and blood reaction occur, then you can give cortisone and antihistamine, steroid with antihistamine. Otherwise, in case of septic anaphylactic shock, you give antihistamine. Antihistamine is the drug of choice. In case of hypovolemic shock, you know that if hypovolemic shock develop to the hypovolemic shock, what is the treatment? Blood transfusion is the treatment. Volume reduce, but blood is not available, then give the saline, normal saline, isotonic 0.9% normal saline, 0.9% normal saline, or isotonic solution. Normal saline is that hypovolemic treatment. Hypovolemic shock, the treatment is normal saline. Keep the normal saline. Then how much blood volume loss? Guide the blood volume. Understand? Sometimes the patient develop 2 shocks, 3, 4, 5 combination. If combination shock developed, if neurogenic septic, then in case of neurogenic shock, pathidine. In case of septic shock, who is responsible? Bacteria. If bacteria, they antibacterial antibiotic. If viral, antiviral. If protozoa, antiprotozoa. If helping, anti-helping. So combination of shock is developed. What type of shock develop in combination? First find out that, then give treatment, management of shock. So my friend base supporter all over the world, thank you very much. So my friend base supporter, for my patient, remain pulse oximeter. What is your pulse? Oxygen saturation, you see that, and respiratory rate above, go to the below 10, above 24, go to the hospital. And pulse rate go to the 100. If your pulse rate go to the 100 and respiratory rate go above 24 or below 10, and pulse rate above 100 or below 60, pulse rate above 100 or below 60, or respiratory rate above 24 and below 10, and oxygen saturation reduced to 80, go to the hospital. Those are my patients. Use pulse oximeter and check that. Thank you very much. Don't be panic. Go to the hospital and patient doctor find out that and say the doctor the pulse rate, respiratory rate. How you count the respiratory rate? Pulse rate by use radial pulse. Also other pulse. You can see the radial pulse. Then you would see the respiratory rate. If respiratory rate increase, what happens? Sometimes if you have not asthma, in case of asthmatic patient, look like. In case of rate, that my and go to the hospital and give the treatment, say to doctor, and pass rate, respiratory rate, also respiratory rate per minute, stopwatch or watch how many, for example, how many breath I already take a breath, second breath. So you see the 1 minute breath rate, pulse rate, and oxygen saturation. If go to the below 80 per oxygen saturation, then go to the doctor. Go to the doctor and 82, that is the condition, and below the 80, you go to the hospital for medication. Thank you very much, my friend supporter. Today is enough from medical science. So pass was repeated. Thank you very much, my friend supporter. Today from the today's topic medical science. How you become a healthy. For healthy disease free, if shock develop, you know that every patient can die. Maximum patient die in that situation. Before death, shock develop. Either neurogenic, cardiogenic, septic, anaphylactic, hypovolemic shock. If you cure the shock, then you should have chance to alive and remain, remain. You should have chance to alive, and how long alive. So disease free, remain disease free, and if disease occur, say one and only get or name and go to the doctor, take the treatment, and remain a healthy, wealthy, wise, secure life. Thank you very much, my friend supporter. Today is enough from science class.